My name is Too Cute. I'm with Too Cute Presents, and you are watching Sensational Living. Today, we have with us Dr. Neil Patel. Dr. Patel is a
vascular and interventional radiologist.
Yeah, that's way too many words for me. I'm sorry. He had to come in on that one. But today we're talking about those nasty little varicose veins, and along with varicose veins, sometimes you get clogged arteries. So Dr. Patel is going to explain this to us today so that we could become more educated on what we can do about them, the symptoms, and if we need to come in and talk to him.
Okay. Yeah.
But I'll come in and talk to him anyway. It doesn't matter.
So sometimes people talk about I have poor leg circulation and it's causing them pain and problems. So when we talk about leg circulation, it's you have arteries and veins. And for the veins, lots of people have these varicose veins. We call it chronic venous insufficiency. And when you start to get symptoms from it, then you may need treatment. So basically, certain patients will have the complaints of their legs are feeling tired, heavy, they get swelling in their ankles. I have a lot of patients who they feel like their feet have gotten a little darker, and that all can be from these varicose vein issues. And so what happens is varicose veins, if you're risk factors, maybe if your family member may have had varicose veins, you're at a higher risk of getting varicose veins. Women who have had multiple pregnancies, being on birth control pills for a long time in the earlier years of their life, they may have issues with varicose veins. You don't always have to see visible varicose veins to have problems with your veins. First-line treatment, you can try compression stockings. If those make your legs feel better, and a lot of my patients have trouble wearing it, especially in the summertime. There's other treatments that you can do to get rid of the problems associated with the varicose veins. And I use a laser that goes into the vein and it burns the vein. It's a very minimally invasive procedure. It takes about 30-45 minutes to do, and you go home same day. You can even go back to work, and it's a quick treatment.
Okay, so how do you do that? I mean, what if I had really bad veins on both legs? You would do both legs, in one treatment, or do you do certain parts of the legs, or how does that work?
It varies patient to patient. Usually we focus on one leg. If we can treat a couple of veins at one time, I sometimes do that. It depends on how complex the vein anatomy is, and it's done with local anesthesia. So you don't need sedation and things like that.
So I don't have to bring anybody in with me?
Yeah, exactly.
Okay, and I can drive off?
Yeah, unless you want sedation, but the majority of my patients just do it with local anesthesia.
Would that be both the veins and the arteries?
So that's just the veins.
Okay.
For the arteries, people have problems with blocked arteries. Typically those patients they may have risk factors of long-standing diabetes. People that have smoked for a long time, they can have blockages in their arteries and their legs. Also being elderly, people with kidney problems, those can cause blockages in the arteries. And symptoms for blocked arteries can include, you may have noticed it in your parents or people who've smoked for a long time. They can walk a certain distance, and then they have to sit down and rest, and then they feel like their legs get better, and then they can walk a little further, and then they have to sit down and rest again. So that's a common symptom. Also, people have ulcers in their feet and things like that. That could be from the poor circulation, commonly from diabetes, but not always. So even on the vein side, you can get ulcers on your legs from the veins, and they happen more on the ankle veins. But these are, certain for the arteries, the blockages. I also do a minimally invasive treatment for that, where we go in, make a little 5-millimeter incision, and then we put these catheters into the arteries where the blockages are, and we try to open them up. And so that saves lots of times from doing bypass surgeries and things like that.
Wow.
Yeah.
That's a lot to be beautiful, because I could just put some pants on and keep it moving, you know? But I guess if I want to have these beautiful legs out so everybody can see, because I'm still looking for a man, by the way. You got a brother, an uncle or somebody, I'm always willing for that. Okay, I'm sorry, I'm getting off track. But it is something that we do tend to share with our friends, because it's one of those things that happens. Do you think that wearing high heel shoes has anything to do with it, or?
It's not really high heel shoes for the veins. Lots of times it's just being on your feet a long time. Like if you're standing on your feet all day working, what happens to your veins as you age? The vein walls become a little weaker, and so the veins can get bigger. And the veins take the blood away from your periphery of your body, like your feet, and bring it back up to the heart. And so to prevent the blood from going back down to the feet from gravity, you have these valves in the veins which close. And when the veins are young and healthy, they close properly. When you get older and the veins get bigger, those valves are shut so the blood can leak back, and that's what causes some of the varicose veins, the swelling in the ankles, the dark discoloration in your feet, and that's just from the blood pigment depositing in your feet, because that's the most dependent portion with gravity. So,
is there any prevention?
Wearing compression stockings, I always urge my patients to, especially, during pregnancies and things like that. Lots of women's, their feet swell. So it's good to wear compression stockings during the time.
So you would recommend support hose as well?
We always do first line treatment, support hose, and then if it makes your legs feel better and it's just trouble wearing it. I have a lot of patients who have severe arthritis and they can't put them on, so those patients, and if you just can't tolerate the compression stockings, then doing these minimally invasive treatments help as well.
Okay.
Yeah.
Well, now you have heard from Dr. Neel, Neel Patel, and look him up or look me up. Too Cute Presents at gmail.com or toocute.net, TUKUTE.net. And you can also look up Sensational Living, because that is what will happen to you when you have this procedure done. You will be living a sensational life, I promise. So look up Dr. Patel, and thank you so much for coming in today.
Sure, thank you for having me.
And look me up too, because I always like to meet new people, and we're going to have him talk about some of the things that we have discussed with his medical facility here, and you will get to learn how to find procedures that are not common but should be. Okay? And you can ask questions. So, thank you very much for joining us. Thank you.
When you catch the light at its most divine, you know that you've been lost.
Hi, I'm international award-winning magician Mondre, and I'm living a sensational life.
Don't you know you're lucky? Don't you know you're lucky? As you watch the day become the night. Now it's really
Hi, I'm Dr. Neel Patel. I'm a vascular and interventional radiologist, and I'm here to help you live a sensational life.
turn your body to the light. Feel it sink into your skin.
I am Michelle Barada from Define Contours and Wellness, and I am living a sensational life.
Makes you feel so lucky. No, it's in